5-minute chat about...
I'm just laughing today. I don't know what's wrong with me.
5-minute chat about signs and symptoms to watch for as you get back to exercise. Some of them, if you've been following along with us for a while, and we know some of you have, you should know these ones already, right? So things like...
I leak a little bit, but it's not a big deal.
That's one we hear a lot. Or things like...
urgency.
Yeah, I pee before I run, but then when I start running, I still feel like I have to pee.
Or I just peed and I put the baby down and then I had to sprint back to the bathroom again.
And go pee again.
5 times before I actually went to bed.
Or I hold it the whole way through the run, but as I'm coming home, I really have to rush to get home in time. Key in the door.
Or I do a workout and then I have heaviness, or I feel like there's something in my vagina.
Yeah.
Or I wear the baby carrier and I feel like there's something in my vagina.
Or I have a poo and then I feel like there's something in my vagina.
That's a very common one.
Yeah, it's a very common one. I think also things to think about are like breast pain.
Yes.
If you've had engorgement or you're breastfeeding and you've got like new to you boobs when you're trying to learn how to exercise. That C-section stuff as well.
Yes.
So a lot of people talk to me, it feels like their abdomen is falling forward or falling out. It doesn't have to be just C-section alone, but we do tend to see that a bit more in C-section.
Yeah.
Or their scar is pulling on them funny, they're getting scar pain.
Or like even with C-section, sometimes like abnormal sensations like down into the groin area or like through, and not that can be normal too, but that's also something I think that's overlooked a lot.
Yeah. And pain, vaginal pain.
Yes.
So, oh my gosh, if you're, and Eryn's mentioned this in the past video, but if your symptoms are not improving, especially for pain, they should be getting better and better and better. They shouldn't be staying static. They shouldn't be worsening at all.
Yeah. And we saw a lot of this, I think, it's getting better obviously, but during COVID when appointments weren't as in person as much, we'd have, especially first time births, person would come in, get checked, and they'd be like, I've been having so much pain. And we're like, wow, you actually really need medical follow-up. This is not where we would expect your healing to be. You need to see a medical professional. But they thought that was normal pain because they had never given birth vaginally before. So unfortunately, we have seen a lot of that over the last 3 years. So I just think like, again, if things don't seem like they're improving daily, weekly, like heading in the right direction, of course it's going to be like this, right? Yeah. But you should be trending in the right direction and feeling more and more like yourself. Yep. If not, it's a great opportunity to call back and check in with your doctor if you have access to that. We know not everybody does. Or reach out to a pelvic floor physio if you have access to that. Because again, we can see you before that 6-week mark. Yeah. And even just talk you through some stuff to kind of like look at, watch for. Yeah. And even like externally, visually looking sometimes can make a big difference without having to do an internal exam.
Yeah, it's funny that you say that. I was going to say the other thing that we hear a lot early on is abdominal separation. Is that medically, I find the medical world has less concerns about that, but from an aesthetic point of view, which is important, and important if it's important to you, is what I mean, right? Although I find a lot of women will say, hey, I don't like how this separation is making my abdomen look, and it's very dismissed because it's an aesthetic thing. Yeah. But I think that warrants a whole discussion about like why is it aesthetic for you and what can be done from a very conservative perspective. But that will continue to heal as well. So we're talking about like really early on symptoms, as Eryn's saying, like they should be getting better and better. And so sometimes, it's a wait and see approach, and sometimes it's a more active approach where we actually should be implementing some sort of therapy.
So should I go to my like mouth open throat analogy?
Yeah, go for it.
The other thing I find happens a lot between 0 and 6 weeks is that people, if they choose to, will have a look. They will get a mirror. They'll use their phone on selfie mode.
Brave.
And they will send me a very panicked email saying, I am seeing things I've never seen before. And I say, it's probably a normal structure. It's just before you had a baby, your opening was in a very closed position. And now it's kind of open a little bit. So you're seeing a little farther in, kind of like if your mouth is closed versus open, you see the back of your throat. Mm-hmm. So usually I just reassure people and say, totally normal anatomical structures. It's just not something you've been used to seeing. So I find that makes people feel a lot better too. So just know that if you decide to take a look, you don't have to, but if you do, don't panic.
Don't panic. I think it's interesting that you say that because at in this first 0 to 6 weeks is when people will start to get back to exercise, and maybe they were getting better and better and better, and then they return to an exercise that might be too aggressive, and then they start getting symptoms again, right? So that's really what we're asking you to monitor 100%. For, right?
Yeah. And I think too, like, there's actually pretty good research saying that like waiting until the 6-week mark to start to try some of the activities you're hoping to get back to is actually too long to wait. I'm not saying go for a 5K run. I'm just saying like try some walking, try some longer walking and see if there's any issues that kind of pop up, or, you know, try, you know, doing a few reps lifting your baby and see how that how that feels if you're planning on going back to weightlifting. Try a few things and see how your body responds, because otherwise you're gonna get to your 6-week mark, not have tried anything.
And then you go to the doctors and they're going to say, do you have any symptoms? And you'll say no. And they'll say, great, return to intercourse, return to exercise. And then you'll have symptoms. And then for some people, it's really hard to get back in. So that would be a great opportunity to come into pelvic floor physiotherapy. But if you can always get back into your doctor, that's excellent. Yeah.
5:45.
Yeah, we went over by 45 minutes. Bye.